At Ardent, our purpose is caring for people. It's our patients, it's our communities, and one another. And that purpose really drives our company in terms of how do we provide the services, how do we enter communities, how do we work with the people in those communities to meet their needs.
We are a company that owns hospitals, but we're not a hospital company. We are a health system. We incorporate the four walls of the hospital along with long-term vision to meet the consumer where they want to be met, whether that's in an urgent care, whether that's in a telehealth visit.
Patients have needs across their continuum, and so to be able to enter into a community and not just have a single hospital, but really have an ecosystem of care is really important. We're not dots in a map. We go into a community, we go deep. We're really focused on growing small and mid-sized urban markets where we know that we can make an impact.
I think coming out of the pandemic, you're seeing people take more control of their health. If you think about what most individuals expect in their lives is convenience, and that's access.
Ardent has focused on really understanding the consumer and then placing technology at the fingertips. So whether we're thinking about it from a website perspective or from a mobile perspective, whether you prefer logging into an app or getting a text message, we're always trying to think about what's most convenient, appropriate, and accessible for the patient.
Quality is super important at Ardent, and so is safety. And so we teach lots of techniques to help people understand where there's opportunity to have a failure, make a mistake, and we want to protect and safeguard against that. There's been a lot of new innovation coming out, and we're choosing the things that are going to be most helpful to the nurse at the bedside. Things like automated vital sign collection tools, or a button that can be put on a patient's chest and monitor vital signs much more frequently than what we would be able to do manually.
Not only do we have the ability now to collect vital signs not 4 times a day or 6 times a day, but 1,440 times a day, this level of information gathering helps us identify patients who would otherwise have deteriorated 6 hours later. So we've had a reduction in codes outside the ICU. We've seen a reduction in mortality. We're identifying people earlier on that need to go to a critical care unit. We've reduced length of stay. Good workflows lead to good clinical outcomes, which lead to good financial outcomes. You need to have a sustainable financial model if you want to have a stable clinical model.
Today, we are centralized and standardized for the back office functions, and so that creates a much more scalable platform for future growth and future success.
So while healthcare is still delivered locally, the supporting resources that allow us to provide the access, to provide the convenience, to provide the best outcomes possible really come through the strength and the experience that we're able to bring through our collective network at Ardent.
Culture drives a huge positive output for our staff to improve clinical outcomes and improve patient experience. People who feel like they belong to an institution that achieves superior clinical performance have a sense of ownership. So when your own staff feels that brand of clinical excellence, the cascade effect for outcomes and patient experience is profound.
At the end of the day, I show up and do this work because I want to see the impact of better human life, quite frankly. I think we're making the right investments on behalf of our consumer, on behalf of the people who live in the communities that we get to serve.
We know healthcare, and we know what it takes to successfully deliver both superior clinical outcomes as well as financial outcomes. And both are important in the world that we live in. And so we know that it takes a careful and coordinated balance to make a strong and sustainable company. And that's what we believe we've created here at Ardent.